Is your skin red, dry, scaly, and extremely itchy? Have you been diagnosed with eczema? This skin condition is believed to affect over 30 million Americans. Eczema isn't a single condition, it's usually a group of skin conditions, and this includes atopic dermatitis, contact dermatitis, hand eczema, neurodermatitis, nummular eczema, and stasis dermatitis. Finding a soothing, natural eczema treatment can be life-changing for those suffering from these conditions. Eczema typically first appears in very young children, with research finding that 65% of cases occur before infants hit their first birthday. 90% of those affected have their first case before they turn 5 years old. Of further concern is that eczema in children is becoming more and more common. Diseases eczema can resemble include psoriasis, rosacea, and dermatitis, but it's a different condition. A study conducted by the Department of Pediatrics at Cincinnati Children's Hospital Medical Center found 39% of the Caucasian children developed eczema by 3 years of age. Interestingly, the same study found that children that have a dog in the home are significantly less likely to develop eczema. Although initial outbreaks of eczema most often occur in infants and young children, the onset can occur at any time. While the majority of skin conditions that fall under the eczema heading are chronic, it's important to note that contact dermatitis and hand eczema might be acute in nature, occurring due to an exposure to an allergen or a chemical. For many people, the severity of the flare-up will lessen with maturity, and some might even outgrow it. However, eczema can come and go throughout life. Learning how to treat your eczema and identifying the triggers that cause the flare-ups is the best course of action. While there's no definitive answer as to the cause of eczema, and there's no identified cure, there's effective natural treatments, home remedies, and essential oils that can help prevent the future flare-ups and ease discomfort during an outbreak. It's important to understand that eczema is embarrassing, stressful, and frustrating, and it often disrupts sleeping patterns. Finding an eczema treatment to help relieve the symptoms must be a top priority. There's a wide range of causes and risk factors associated with eczema, and the eczema symptoms can manifest differently between those who are affected. While a singular cause of the eczema has not been established, there are certain common causes that lead to the onset and to the flare-ups. Some of the risk factors for eczema are a genetic predisposition or a family history to eczema, hay fever, or asthma, a young age, being a healthcare worker, having children that attend daycare, having ADHD, living in a dry climate, nutritional deficiencies, adolescent obesity for later onset of eczema cases, and low vitamin D levels during pregnancy might increase the risk of developing eczema in the first year of life. So far, the medical community has yet to determine a definitive cause of eczema. For some, it might occur due to a nutritional deficiency, while for others it might first arise due to an allergen or another irritant. Some widely accepted causes of eczema are dry skin and sensitive skin that cracks, immune system dysfunction, and environmental conditions, gene variation that affects the skin, allergies to food, beauty products, laundry detergent, and other chemical allergies, chronic stress, and temperature changes. While many will experience a lessening of the symptoms and fewer flare-ups as they age, some will continue to experience the eczema symptoms throughout adulthood, such as atopic eczema rashes. The symptoms can range from mild to severe, and they can change from one outbreak to another. The common symptoms include the appearance of small, raised bumps that can ooze liquid and develop a crust, thick, dry, scaly skin that cracks, red, brown, or grayish patches of skin on the hands, feet, ankle, wrists, neck, upper chest, eyelids, in skin folds, and on the face and scalp of infants. Sensitive skin that's swollen and raw from scratching. A recurring rash that can cause intense itching, often disrupting sleep patterns. And rashes due to atopic eczema. While there's no cure for eczema, there's a variety of non-invasive treatment options that can provide relief during a flare-up, and some may prevent its onset. These can include corticosteroids, but the following home treatments are the best. According to the National Eczema Association, phytotherapy helps to calm inflammation, reduces itching, increases vitamin D production, and helps to fight bacteria on the skin. Adding 10 to 15 minutes a day of sun exposure, particularly during an eczema flare-up, can provide relief and potentially speed up the healing. In addition to increasing sun exposure, supplementing with vitamin D-rich foods like cod liver oil, sardines, salmon, eggs, and raw milk might help to prevent eczema in children and adolescents. Ideally, during a flare-up, you'll get 2,000 to 5,000 international units per day. If your sun exposure is low, consider boosting your intake with a high-quality supplement. Preliminary research shows that low vitamin D levels during pregnancy and during childhood might increase the risk of developing eczema. Because dry skin is both a cause and a symptom, it's imperative to moisturize the affected areas at least twice a day. Coconut oil is a perfect moisturizer for eczema sufferers. This eczema treatment is antibacterial and antifungal, with antimicrobial properties that provide soothing relief and may speed the healing. According to Harvard Medical School, some skin conditions, including eczema, have a psychological component. This is referred to as psychodermatology. The researchers have found hypnosis, mindful meditation, progressive muscle relaxation, focused breathing, cognitive behavior therapy, and talk therapy may all provide not only relief during a flare-up, but expedite the healing and prevent future flare-ups. The Dead Sea is known for its healing power, and researchers have found taking a bath with the salt from the Dead Sea improves skin hydration, improves skin barrier function, reduces inflammation, and relieves redness and roughness. As eczema flares can worsen when exposed to high and low temperatures, bath water should be just warm enough to prevent a chill. Don't rub the skin dry, instead pat it gently with a soft towel. Applying a cool wet compress can lessen the itching for some individuals with eczema. For young children, dampening snug night clothes may provide overnight relief from the itching. However, if the eczema has evolved to oozing blisters, a wet compress may increase the risk of infection and should not be used. The intense itching is often the most miserable part of the eczema flare-up. Try using a natural homemade eczema cream that incorporates shea butter, coconut oil, raw honey, and essential oils. Used topically, licorice root shows promise for reducing the itching in limited eczema trials. You can add a few drops to coconut oil or homemade itch creams for best results. Researchers from the Norwegian University of Science and Technology have found when fish is introduced into the diet of young children by the age of 9 months, and the fish is eaten weekly, the risk for developing eczema reduces dramatically. During a flare-up, these foods are a great eczema treatment, and they'll boost the immune system's function and they'll speed up healing. Probiotics may help to prevent eczema in infants and to decrease the severity of flare-ups. Mothers who take probiotics during pregnancy and while breastfeeding may prevent eczema from developing in their children. During an eczema outbreak and to prevent future flare-ups, taking a high-quality probiotic supplement of 24 to 100 billion organisms per day should be considered. In addition to the intense itching, eczema commonly causes anxiety, depression, frustration, and poor sleep. Lavender essential oil is an eczema treatment proven to help reduce these common symptoms, and it can help to deal with the dry skin. Add 10 drops to 1 tablespoon of coconut oil or almond oil, and then gently rub it into the skin. The aroma can help to facilitate sleep when itching is often at its worst. Taking 400 international units of vitamin E per day can help to speed up healing by reducing inflammation. In addition, topical vitamin E might help to relieve the itch and prevent against scarring. If, during a flare-up, the rash starts to ooze, apply witch hazel. This can help to promote healing due to its anti-inflammatory and antioxidant properties. Research has found a cream that contains witch hazel and phosphatidylcholine can be as effective as hydrocortisone in a double-blind trial. During an outbreak, gently dab the eczema treatment directly onto the rash with a cotton pad. Be sure to use an alcohol-free witch hazel, as you don't want to cause more dryness. Some foods to eat to help treat eczema. You want essential fatty acids like wild fish, flaxseed oil. Pumpkin seeds and chia seeds provide zinc, and this is essential for wound healing and metabolizing the fatty acids. Probiotic-rich foods. You want high-fiber foods. Constipation can lead your body to look for other ways to expel toxins, and the skin can become one of those avenues where the toxins are expelled. Aim for at least 30 grams of fiber per day from vegetables, fruits, nuts, seeds, coconut, and sprouted grains and legumes. You want vitamin A-rich foods. You can increase your intake of orange and yellow-colored vegetables, which are high in vitamin A, which is necessary for the skin's health. You want to avoid additives and processed food, as these can make eczema worse. You want to remove food allergens. Avoid any potential allergen, and some common allergen foods like gluten, dairy, shellfish, or peanuts. Avoid margarine and other non-essential fats. These fats can interfere with the absorption of the essential fats that are critical for healing. They can also cause inflammation. You want to cut out sugar, as this increases inflammation and reduces the immune function. And cut out fried foods. Eczema is a skin condition that can result in severe discomfort, disruption of sleep, cause anxiety and depression, and skin infections. In fact, according to the Mayo Clinic, the majority of people that have eczema also have a Staphylococcus aureus bacteria infection on their skin. When the rash weeps, the excessive itching can break the skin. Severe infections from the bacteria and viruses can then occur. If an infection does occur, following natural impetigo treatments can help prevent spreading the infection to others and speed up the healing. Eczema may make people more prone to heart disease and stroke, as research is highlighted by Harvard Medical School. The study found people with eczema smoke and drink more, and they're less likely to exercise than those without eczema. All three of these factors are considered risk factors for heart disease and other chronic conditions. Anxiety, depression, and poor sleep quality are real concerns for children and adults. Using essential oils for the eczema by diffusing or adding them to lotions and creams may help to relieve the emotional toll that this condition has on the body. Children are particularly prone to ridicule at school during an outbreak, especially when the eczema is on their face. It's not uncommon for the children with eczema to withdraw from their social circle and become isolated. Be sure to provide plenty of understanding and support. Over 30 million Americans have eczema, and there's no cure. There's 7 skin conditions that fall under the eczema heading, including contact dermatitis, dyshydrotic eczema, hand eczema, neurodermatitis, nummular eczema, eczema stasis dermatitis, and the most common offender, atopic dermatitis. 90% of those affected experience their first eczema outbreak before they turn 5 years of age. Eczema patches can appear anywhere, but in children it typically develops first on the cheeks, the chin, and the scalp. In adolescents and adults, eczema patches appear in areas that bend, like the elbows, the knees, the ankles, the wrist, and the neck. Understanding what triggers it and how to get rid of the eczema flare-ups requires careful tracking of the allergens and all the flare-ups as they occur. To prevent future flare-ups, avoid common triggers and allergens, including eggs, soy, gluten, dairy, shellfish, fried food, sugar, peanuts, trans fats, common food preservatives, and artificial sweeteners. Treat the mind and the body for the best results, as an increase in anxiety and depression can worsen the symptoms, and stress is believed to cause a flare-up in many adults. Moisturize the affected areas at least twice a day to help to soothe the dry skin, to relieve the itching, and to speed the healing. Mothers who take probiotics during pregnancy and while breastfeeding may help prevent eczema in their children. Introducing fish to young children may help prevent eczema. Having a dog may also help to prevent children from developing eczema. To book a consultation or to learn about herbs, supplements, and natural treatments, check out my website.